Rebecca Smith. This is Glory. I am here representing Crisis Canines in the Midlands. My day job is that I'm a veterinarian and co-owner of Midland Prairie Veterinary Services. We have 3 clinics in Jasper and Story counties. And my husband is a critical care paramedic, primarily works with Knoxville Fire Department, but also with Jasper County Sheriff's Office as a paramedic in their fly car program. So, as a veterinarian, always have had a passion for animals, and dog training has been my hobby. So, this program came about when Glory was a puppy at a client of mine's kennel, Auto Horse Kennels, out of Altoona at that time. And she was a new puppy to the kennel. Anna had to go out of town. I said, I'll take Glory home for the weekend so she doesn't have to be in the kennel, and Glory never went back. So, just having her home for 1 weekend, Justin had been inspired by the work that DCI Special Agent Kristen Kotris out of Council Bluffs had been doing with the first crisis response therapy canine in the state, canine Matthew Pickles. And he is a golden retriever. She went through the certification program through the academy in Ohio, Columbus, Ohio in 2020. And Matt has been in service since then. So we started training Glory with that goal in mind, just out of our own pocket, with our own passion, and we took her to the same academy in Ohio to achieve her same level of certification in November of 2022, so almost exactly a year ago. And about halfway through that process, we were inspired by the demand, by the outreach that we were getting. Can you bring Glory here? Can you talk about what you're doing with her? Where's this program going to go? And then other departments started to get interested. Can we do this in our department? How do we get started with a dog? And so Justin and I founded Crisis Canines of the Midlands in 2022 with the mission of helping fundraise, essentially, so that departments, no matter their size, would have the potential to implement this program to help peer support within their own agencies and other agencies, as well as in the community. So a little bit about how this works. There we go. This is just some quotes from research behind this, and one of our handlers and his partner in training. There's a lot of research behind how animal-assisted crisis response works. I won't get into it in too much depth because our time is a little bit limited today, but essentially, this is the science behind it. A critical incident happens, and our brain shifts into fight, flight, or freeze mode. There is a huge release of stress hormone, cortisol, and it puts everything into our central brainstem. I want to survive. That's the goal. If we don't shift out of that mode to start processing, that's where PTSD, long-term trauma damage, comes from. The goal of our program is not to be the end-all be-all, but to help to initiate healing on the front line, rather than waiting until it causes trauma down the line. We've seen this firsthand, and Justin can speak to this better than I can, but first responders go on, in Knoxville, an average of 9 calls a day. And at least once, I would say at least one of those calls is going to be a critical incident. Something where life or death hangs in the balance, and then have to go back to the station, get the rig ready, be ready for the next one to go out. There's not a lot of time to process there. So there is a huge increase in stress-related post-traumatic stress injury in first responders as a result. Don't have time to process that. So in addition to looking at the people that are affected by those critical incidents and are in the midst of a trauma response when the first responders are on scene or just in the aftermath of a critical incident. So the goal behind what we do is based around the fact that there is science behind one, a mirroring effect. So Gloria's doing a perfect example of this right now. Let's say we're in a group debriefing of a critical incident of first responders and public that were affected by a huge incident, a bus crash, let's say, where there was loss of life. There's going to be a group of people and their emotions are amped at that time. There's a lot of people in that group who are in fight, flight, or freeze mode and are not necessarily even ready to talk about it at that point. There's a mirroring effect that our brains have. So if we're stressed and there's something in the room that is the opposite of how we feel, calm, relaxed, sleeping in the middle of the room, even just to see a dog laying in the middle of the room in that calm mode, our brains can mirror that emotion or lack thereof, calm, and help to release oxytocin, which helps to counteract the effect of cortisol, get us out of our amygdala in our brain and back into our forebrain where we can actually process emotion and start the healing process. That's the science behind all of it. We all know that if we're a dog person and a dog comes and lays on the couch next to us and puts its head on our lap and we're petting it, we feel better. That's why. So, the basis behind our program is that the definition of a crisis response canine, what we are aiming to produce, is a first responder handler paired with a certified therapy dog that are trained together specifically for the first responder world, ready to respond with little to no notice, providing a calm, comforting presence in the face of intense emotion, grief, and chaos. Each one of these dogs, after certification, is badged by their department. They are deployed over the radio, just like their first responder handler is. They are a member of their department. They're badged by their agency. There are many ways that these dogs can do what they do. And you can see by the picture that this is kind of her general stance, doing the same thing. This was one situation where we have started to go in and be part of school lockdown drills, active shooter drills, any kind of a change in the normal daily school routine in the counties that we are acting in. So this is in a Marion County school. This was in a lockdown drill. For most kids, that's just, hey, I get out of class, we get to do something different. Well, that's not the case for everybody. There's a certain percentage of kids that do not understand and are really, really triggered by a change in their normal daily routine. This little girl was brought into this room because she was having a really hard time with it. She came in screaming, wailing, rocking back and forth, and the second she came into the room, saw Glory, she got quiet. She came over, we laid Glory down next to her, and for the rest of the lockdown drill, she just sat talking to Justin and petting Glory. And it took her out of fight, flight, or freeze mode, and she was no longer traumatized by the event. That's not always how it works, but that's a great example of how the biochemistry can really help people to not be traumatized. The main objective of what we started with, which is for peer support, have first responders help other first responders. Make it okay to talk about mental health in the firehouse, the police station, the sheriff's office. There's kind of a good old boys network, and not everybody is okay with saying I'm not okay. And part of this is just to raise awareness and say, hey, it's okay to not be okay, we can talk about it. You don't have to talk about it. You can sit on the couch with the dog and de-escalate and let her kind of do her job because she's now part of the crew. We're also all trained in group and individual crisis intervention through CIT or critical incident stress management debriefing skills. All the handlers are trained in those so that the dogs, once certified, can help in debriefings after major critical incidents and with individual crisis intervention. We can also respond just after individual major traumatic incidents. Probably one of our favorite, well, one of the best examples of this that I can think of is there was a very unfortunate incident in Jasper County where a 2-year-old child had chronic health issues, went into respiratory cardiac arrest at home, and his 9-year-old brother started CPR. It was unsuccessful. Of course, all EMS units dispatched to the house, and the house was chaos, frantic, terrible scene. But they had to process this scene while the family was present. They called Justin and Glory. She came in, the family, and especially the little boy, basically went through the house, out to the backyard, and the little boy sat in the backyard with Glory for hours while they processed the scene and took care of the situation. And he didn't have to witness any of that. He didn't have to be pulled away from his brother. He was still at home, but he was laying in the backyard with Glory. And So about 5 months after that, we were at a national night out in Newton just a couple months ago, and I was there with Glory, and a little boy comes running across the parking lot, gives her a huge hug, and said, "This dog was at my house when my brother died." He remembered that incident, gave her this huge hug, brought all his friends over to introduce them to the dog that was at his house on the worst day. So it's just one of those things that says, okay, we're doing the right thing here. This is making a difference. So lots of other ways that these guys can be used. These are our teams currently that we have in training across the state. Knoxville Fire, Pella Ambulance, Bondurant Fire, Newton Fire, Johnson County Sheriff's Office, Clark County EMA, Kossuth County EMA, and Urbandale Fire all have teams in the works. And basically how this works is we help select a canine candidate based on their temperament and overall health. My clinic and myself, we donate all wellness services to all dogs in the program. And Purina and some other manufacturers donate a lot toward these dogs being a success. We work with Anna Child's Canine Training out of Autohorse Kennel. She's now in Swan, Iowa. She's adapted her program specifically for us to help us all reach our goals. And then we will have the first ever 2024 Canine Academy in Iowa. The Ohio team, Master Trainers Dara Metz and Mike Pollins out of Ohio are going to be coming to Iowa the last week of March to do the academy for all of our teams in training. So they'll be certified then. Takes about a year to get us from start to finish with these teams. And our goal is, we know it takes about $10,000 to get all of this done for each team. And our goal is to help departments implement something new without it having to be a financial burden. So that's why we started our nonprofit. Justin will tell you very honestly, even though he is in leadership at Knoxville, if he would have gone to the chief and he would have said, "Hey, I want to put this program, it's going to cost the department $10,000, no. It's going to take 3 years to get that through all the red tape that it takes to make that happen. But since we did this ourselves, we know what it costs, we know all the steps to get there, we can now, we've got a lot of partners on board. We've had great success with community action grants, local businesses that just want to sponsor this program and make it happen. And so we've really had a tremendous amount of community support for all of these teams in making sure that this is not a burden on their local department to get this implemented. Once implemented, the maintenance is no more than any other dog. So it's not a huge financial burden on a department once this is implemented. It's different than an apprehension dog, drug dog, etc. So this was our academy in Ohio with teams across the country, including 2 teams that flew their dogs down from Canada, including this giant beast over here who was on an airplane from Canada. He was a great dog. And that's basically what we're doing. Got some information in front of you, an example of one of our baseball cards that we have for each of our dogs. This is Glory's card, and then all of our dogs in training have their rookie cards. So whenever we do a public event or a school visit, we've got kids in every county that are collecting all the dogs' cards. It's pretty cute. So